we're here at West Penn Hearing Aid Centers, and we are with Perry. He's an audiologist. Would you like to introduce yourself to folks and let us know what an audiologist is and does?
Okay. Well, again, my name is Perry Constantino, and I am the owner of West Penn Hearing Aid Centers. And our role here is to help people hear better. And we do that by looking at different aspects of your hearing loss and determine what is the way that we can help correct it. And most all ways that we do this is going to be through hearing technology. What
are some of the tests that I can expect you would do for me that would determine what type of hearing loss that I have?
Well, the first thing we're going to do, like all places, that you're going to have to fill out some paperwork, right? But our paperwork is a little bit more specialized than just asking you what kind of situation it is. We'll ask you about different things that you might have experienced or things that you have noticed. And then we're just going to simply have a sit down. We're going to talk about what you're noticing. And if there's a family member, which we always employ of having there, because they're the ones who are going to rat you out. Right? They're the ones who are going to tell me the truth. That's saying, oh, well, she misses this or she misses that and so forth. Or you do keep the TV louder. And even though, you're going to set the volume that's comfortable for you, which to you seems normal, but to the rest of the family, it may seem like it's a little bit more than normal. They'll let me understand about what's going on. Then we will do a videotoscopy, which is basically an inspection of your ear, but we put it actually on a TV. And I'm a huge believer in letting you understand and teaching you about what is happening. So you actually get to see the eardrum and the ear canal. And it will look for anything that looks out of the ordinary. We'll look at the eardrum itself, the tympanic membrane, and see if there's any holes or perforations. If there's any discolorations that we need to look further into it medically. And if we need to do an immediate referral. Most cases, they're not that way. Easily, 90% of the people with hearing losses do not have medical situations that can correct their hearing. It's usually what we call nerve deafness, sensorineural loss, and sometimes it's from ear infections that occurred. A lot of times it's from noise. Noise that they had, you can inherit a hearing loss. It's usually a combination of those, but usually it's because of noise. And it's equally distributed, whether it's men or women. So then we go and then we sit down and then we talk about some specific areas of concern that we need to correct. And then what type of options, size-wise, way we're going to fit it. Is your lifestyle more active? Do we choose something that is going to be less of a concern? Or do we find a person who's in a lot of different listening environments? All said and done, you're looking at about 2 hours that we'll spend just to make sure we understand exactly where the hearing loss is at and what you want to correct. And then hopefully through this process, we take a little bit of that fear away and thinking that, well, this is not age, because it's not. I will tell you what age has to do with it, though. As we mature in life, things don't work as fast as they used to. I bump something and I wake up in the morning and it hurts and I didn't do anything the day before. And sometimes we get into noisy situations where the brain just doesn't fire up as quickly as it used to. So it becomes, even if your hearing was perfect, more difficult to hear in a restaurant or more difficult to sometimes putting things away. So when you combine that little bit of slowness with a hearing loss, then it becomes 3 times more obvious. And that's when we take care of it. But it shouldn't be then. Because the sooner I can attack and get the stimulus and sound back into the brain, the better I can do in making sure that the brain continues to recognize sounds properly. Because there are times where there are sections of your hearing that if it drops off completely, even though you have other parts that still hear, that I won't be able to solve this clarity issue, or that I will not be able to help you hear better in church or in that restaurant where there is 50 people. Those kind of situations. And some of it is just have the family understand what they have to do to make your life better, such as getting your attention first and then talk. We do have a very bad habit in our busy worlds to simply talk as we're walking out the door and not even realizing that that person is talking to me. And the thing about with people with hearing loss is that they need to know you're talking to them. And they require to think about it. It may be an only extra second that allows them to process something. But that one extra second means that I missed the first two sentences of what you said, and I'm lost.
So when you take that hour getting to know your patient for the first time, that's very important, getting to know them and their situation and their personal lifestyle, because all of that plays into what type of technology that you have available that will help them the best.
Yes. It's I think what allows us to be more unique, because we spend that time to get that personal attention done and to find out. But remember, because we're not treating the hearing loss. We're going to be treating what the hearing is left. So we're looking to see how much hearing is left, and then how can we make that hearing better in that situation? Because we all think of hearing loss like Uncle Charlie, who sits in the corner going, what, or Uncle Joe or Grandpa, so forth. And that's not a hearing loss. That's deafness. And we can't help that. But we do help is that person who finds that the words are not clear, that the words seem to mumble in, or that when I go to church and I cannot hear the preacher, or if somebody has a prayer, I cannot hear what they're saying. These are things that really make a hearing loss acceptable, right? And it's nothing to do, and this is probably a good way of understanding or getting the people to understand that this is really not an age-related problem. People think it's, you have to be at a certain age before hearing losses need to be treated. And it's not true. Most hearing losses occur in their 20s and in their 30s and in their 40s. But we don't take care of it until we're older. And then it becomes a little bit more noticeable because we think it's more acceptable if you're older and have hearing instruments. But in reality, the longer it takes for them to treat that hearing loss, the more difficult and in some cases, impossible to treat. It's real important to understand that the brain does your hearing, not your ears. All the ears do is send little electrical signals to your brain, and then your brain decodes that into speech and music and words. When you hear a letter S and a CH, they sound very similar, but they're radically different when you put them in words. So that if I said the word east and you miss the S, now we're going to grab something to eat. So instead of getting directions and turning right at the corner, we're looking for a restaurant, right? Which is totally different. Or yesterday I went out west. Oh, you got rained on. Yeah, I did get wet too. No, I went to Ohio. And so you'll see then as somebody's walking away and I cannot catch what they're saying, they all saying, well, don't walk away if you're going to talk to me. And these are all very common, everyday type of situations that when a hearing loss occurs, makes it 3 times worse. All right? And that's what we treat. But not all my patients want a hunting program. And not all my patients have difficulty hearing in churches. And not all my patients are always in a restaurant where there's 50 or 100 people. Sometimes they want to be able to hear, their brothers or their sisters or their nieces or their nephews. They want to hear that situation. Maybe they are conducting meetings and there's people asking questions. This is where, again, technology and types of hearing loss become important, because those are the things that help me solve those problems that make it easier for them. So we find ourselves in choosing the technology that fits the person, not the other way around. Right? But that personal attention is absolutely essential to doing this correctly.
What are some of the technologies that you use and that you have available to treat these types of hearing loss?
Well, the technologies are varied, but they're all very good. At one time, we would have, 20 years ago, we had 40, 50, 60 different manufacturers who made instruments. Today, we have 4 major manufacturers, and they're all pretty good. Some are a little bit better than others. Some of them are the ones who fit Ronald Reagan when he first got his hearing aid, and that's Starkey, and they also fit Bill Clinton and George Bush Sr. and Frank Sinatra. Their technology is very good. It's the ones that we prefer, though we are independent. I mean, we can choose anybody and anything. But technology is only as good as the person who's applying it. It's like a great computer. If I do not know how to use it, it ends up being more of a dust collector. But what I feel in the role of technology is that it should make our life easier. It should make our life better and not make it more confusing. And sometimes in hearing technologies, it can get that way, depending on how the person is treated. Next thing you know, you have a remote that you got to carry around your neck, and that connects into the hearing instrument, that connects into your phone. And then if you walk into a room, I can have this connecting into my TV. And next thing you know, by all said and done, the person is so totally confused that all he wanted to do was hear better in church. And we find that we're attaching him to all these different devices, and his world is 3 times more confusing, and as a result, he rejects it. It is definitely the wrong way of going it. You really want to be able to take the situations, the problems that somebody might have, and solve those particular problems, whether that be hearing my grandkids, or whether that hearing my wife, or whether that be hearing when I go hunting. I know getting direction of sound back. Hearing when the friends get together and I can hear in a restaurant better, and treating those specific areas. And that's where technology then becomes a major role in choosing that technology that helps solve those specific problems. And that's what the people out there need to understand, is that when you choose a place to go, you want to find something that's going to take that personal attention and then convert it into today's technology that makes your life easy. So you're not having to carry all different types of straps, that it actually makes your life more comfortable. It makes it safer. It makes it more enjoyable. And when you get those 3 combination of things, you're going to find the person's going to wear it, and it's going to be successful.
In reference to the technology that has advanced over the years for hearing aids and the equipment that we all know to be a hearing aid. We all have a preconceived notion of what that would be. How true is that in this day and age? Are they just as big as they were 50 years ago? Are they smaller? Are they fitted personally and customized to the person? How has hearing aids changed?
The technology today has allowed us to do pretty much any kind of custom fitting that is necessary. I'm a true believer in the smaller instruments. Despite the fact that, as much as I like to say that having a hearing loss does not matter and that you have no ill feelings about it, it's still alive out there. People still fight the idea of knowing that I wear a hearing instrument. So if there's anything that I can do to make this more comfortable for you, then I do it. And that means having a smaller instrument that fits deeper into the ear. And actually, a smaller instrument provides a more natural sound. So not only do you feel better inside here about knowing that nobody can see it, but it actually provides a more natural sound. A lot of the industry today is going with what they call an open ear. It's a thin little wire that goes into the ear with a device sitting behind. Very light, very comfortable. They're nice, but they're only suitable for certain types of hearing loss. So you got to make sure that wherever you decide to go, that you choose what is good for your lifestyle, your needs, not necessarily based on what I like to fit or what the technology is trying to tell me to do it, but tailor it to the specific needs of the patient. And that's where you're going to find a huge difference in your success of using a hearing instrument versus somebody who ends up putting it in a drawer, or somebody I know who once had it but no longer uses it. Right. That's really important to understand.
How important is that to have these good hearing technologies and instruments in place for when you're driving?
Well, I'll tell you what, this is a perfect example of you don't need to be old to realize how those things change. And whether that's driving up to a corner and, swearing that you looked, and next thing you know, there's a person who walks in front of you, or another car comes from a direction. Our senses, our vision, and our hearing work together 99% of the time. Because there are times where you may not necessarily see a car, but you hear that truck coming. So you pause to take that safe route and wait until something happens. Or if you're driving along and there's an ambulance behind you, and hearing it soon enough, that gives you a chance to react and move off to the side. And the other thing, just for anything else but just the person sitting beside you, one of the funny things that we do when we have a hearing loss is that we like to look at the person.
Right.
Well, when you're driving, it may be a good idea to continue looking forward instead of the person beside you.
Right.
So in all reality, you look at a person who, for instance, is legally deaf, all right, in many ways is safer driving, all right, than a person with a hearing loss. Because that person who's deaf is not going to look over because he didn't know you said anything. But that person who has a hearing loss, who missed part of it, will want to look over. And that split second of attention takes 2 seconds to get back on the road And next thing you know, that's the difference between avoiding an accident or getting involved in an accident.
I'd like to thank you so much for taking time out of your day and meeting with us and educating us on hearing loss and its importance. Is there anything else that you would like to add?
I just want to thank you, for the opportunity. It's been a while since we've had a chance to even tell anybody, let alone because we get so busy. So thank you for that opportunity to tell people.
Wonderful. Thank you so much.
Thank you.
Thank you.